quality of the breath sound. So our normal breath sounds is it should be vesicular breath sounds in the periphery of the lungs. So in the middle, here in the area of the bifurcation of the trachea, in the first and second ICS, you will hear bronchovesicular breath sounds. And then in the large airways, you will hear bronchial sounds. But in the periphery, you should hear vesicular breath sounds. Okay? Now also, while you are listening to the breath sounds, you have to take note if there are any adventitious sounds. So adventitious sounds is it can be rals, wheezes, or it can be a ronchi, or even sometimes there can. So those are the three. No? So rals is crackles. So it's like blowing bubbles in a glass of water. Wheezing is like a whistle. It's musical, no? Para sipol, no? And then your ronchi para siyang pumuputok-putok, parang ganon, no? Okay, so you take note if you can hear some adventitious sounds. So you describe, and you have to describe where you hear the adventitious sounds. Do you hear wheezes all over the right lung field, or do you hear crackles on the left base? You have to indicate what type of adventitious sounds and at what area did you hear it. You have to be specific. Okay? Next is we will go to the transmission of spoken words. So transmission of spoken words, it can be bronchophony, egophony, and whispered pectoriloquy. No? So bronchophony, this is how you do bronchophony. So it is like tactile fremitus, but this time you are going to use your stethoscope. Okay? So you ask the patient to say tres tres, tres tres, okay? Tres tres, 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 tres tres. Tres, tres. Tres, tres. So that is bronchophony. So when normal bronchophony is there should be no increase in the or there should be no accentuation of the tres, tres. So parang pagka pinakinggan mo, pagka when you say bronchophony, halimbawa you say tres, 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 then there's an area to be, then there's increase in the volume, so it will be tres tres. So that is bronchophony, which we usually see in patients with consolidation. Okay. Then another transmission of spoken words is you will ask the patient to say E. So this is what we call your egophony. Okay. So we ask the patient to say E as we listen to the entire lung field. So sabi mo E, E, okay, E, 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 okay, E, C, 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 C. So that is egophony. So the normal is you should hear it as E, the sound as being E. But if you happen to hear that instead of E, you hear A, then that is positive for egophony. Okay? Then lastly, you have your whispered pectoriloquy. So you will ask the patient to whisper 1, 2, 3. So only whisper. So bulong lang. 1, 2, 3. So if it's normal whispered pectoriloquy, you will hear muffled sounds. It's very soft, whisper lang. But if it sounds like a normal voice, then that is positive for whispered pectoriloquy. So it's like this, So 1, 2, 3. So if it sounds like a normal voice, not whisper, then you can say that it is positive for whispered pectoriloquy. You again indicate where you appreciated the whispered pectoriloquy. So 1, 2, 3, bulong lang, 1, 2, 3. So that's whispered pectoriloquy. Okay, then whatever you did in the anterior, you do again on the posterior chest. Okay, so dito tayo. Okay, so again, breath sounds first and adventitious sounds, yung malalim. Okay. Okay, cross mo yung arms mo ulit. So listen for the inspiration and expiration. Okay, then bronchophony. Sabi mo, press, press. 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 E, 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 tulog na 1, 2, 3. Okay. So when you report, so let me give you a report for the whole chest and lungs. So chest and lungs, on palpation, inspection, the skin is brown in color, some hyperpigmentation in the sternal area and some hypopigmentation in the pectoralis area, in the pectorals. Okay. No visible subcutaneous blood vessels, no masses, no good muscle development, and no intercostal retractions, no other retractions, subcostal, supraclavicular, no retractions. Static dimension is 1:2. Then normal rate, regular rhythm, no symmetrical in expansion, no lacking. On palpation, no tenderness, no crepitus, no symmetrical in expansion, no lagging, equal tactile fremitus. On percussion, resonant all over. On auscultation, clear breath sounds, vesicular breath sounds in the periphery. No adventitious sounds such as rals, wheezes, and bronchi. And normal transmission of spoken words, no bronchophony, no egophony, no whispered pectoriloquy. So that's how you report your chest and lungs examination. Okay? Okay na.